Subcommittee on Legislative and Budget Process of the Committee on Rules will come to order. I want to begin by welcoming our witnesses and thank them for being here today. And I'd like to thank my colleagues, Chairman McGovern of the Rules Committee and Mr. Burgess, our ranking member of the subcommittee and a member of the Rules Committee for joining as well. Today's hearing will focus on the importance of making strategic investments across the federal budget to build economic resiliency and ensure an efficient federal response to future pandemics and other disasters. Disaster preparedness includes not only ensuring that existing programs are adequately funded, but that systems are in place to efficiently distribute the funding as well. It's critical for the United States government to make these investments before the next disaster occurs, and we've seen that underinvestment in key programs exacerbates inequities already present in our communities. And we inherently know the value of investing in preparedness. In fact, we do it all the time. We invest in public safety infrastructure to quickly respond to 911 calls and help mitigate dangerous situations. The National Weather Service routinely communicates storm warnings to allow local governments and state governments to begin preparations. And these are critical efforts. Are we doing enough in these critical efforts, or are we budgeting enough for them? These type of investments should be prioritized as we think of investments in disaster preparedness as well. As we all know, investments in preparedness cost far less than investments in response measures. And a recent study by the National Institute of Building Sciences found that for every $1 invested in disaster mitigation measures, we ultimately save society $6. So while this fundamental budget principle can be applied to the federal response to many different types of disaster, an examination of the response to COVID-19 is an obvious place to begin. Almost 2 years since the beginning of the pandemic, this hearing attempts to provide an opportunity to look back and, more importantly, have a conversation about what lessons we have learned and how we can be better prepared for the next pandemic. This type of forward-looking thinking is desperately needed, as lessons learned from previous crises have clearly not been taken to heart. For example, even after recent public health crises ranging from SARS to Zika, public health agencies continue to be dramatically underfunded. A recent analysis shows that public health spending accounts for just 2.5% of all health spending in the United States, which comes to roughly $274 per person. This past fall, the Biden administration released a pandemic preparedness plan that focused on strengthening public health systems, improving surveillance and monitoring for early threats, increasing stockpiles of PPE, and investing in vaccines and therapeutics. While I applaud the administration for these efforts and these types of measures that must be enacted, the budget principles behind this plan should be applied to preparedness for other types of disasters as well. From the 2000s to the 2010 decade, spending on FEMA's public assistance program increased 23%. And as the frequency and cost of disasters continues to increase, Congress must consider how to better address disaster preparedness and assistance in the annual appropriations process. And finally, coordination between government and private stakeholders can clearly be improved. Although FEMA is the primary agency for disaster assistance, it's important to note that at least 16 other federal departments and agencies also contribute to disaster relief efforts, and I appreciate in the testimony submitted by the witnesses a number touched on this point. This response structure becomes even more complex when including state and local government stakeholders who, along with the private sector and not-for-profit organizations, are often most directly engaged in local communities. Ensuring that efficient systems are already in place beforehand will dramatically improve the quality of the response, particularly for services where planning and logistics play a significant role, whether it be allowing food distribution networks and supply chains to operate more efficiently or ensuring that funding for government stimulus programs are able to quickly get to families in need. Congress must examine potential changes to this process. So I look forward to the discussion today, which I hope will develop policy recommendations on how to use the federal budget process to build an economy more resilient to future disasters. And with that, the chair now recognizes the ranking member of the subcommittee, Dr. Burgess, for any remarks that he wishes to make.
I thank the chair, and I'm certainly glad that we're holding this hearing. I do want to thank our witnesses for being here to testify, and certainly looking forward to hearing from all of you and learning about how our nation can more efficiently plan our budget to prepare for future pandemics. I can't help but think I'm sitting here in the Rules Committee by myself. This hearing is being done virtually, but it was just a little over 2 years ago that we had one of the first rules hearings to regard the what were the initial stages of this pandemic. And it's hard to believe that not only are we on the second anniversary of that, we are going into the third year of the pandemic. And certainly you can recognize a certain amount of pandemic fatigue around the country. And every congressional district is encountering that and recognizing that. I do hope today's hearing is productive, and I am anxious to see and learn how our budgetary process and our response can improve our pandemic preparedness. And Chairman Morelli, I just have to point out, and Chairman McGovern, that we are probably, you referenced an appropriations acknowledging that there is going to be future disaster mitigation necessary. We are actually about, 3 weeks away from the lapse of an appropriation lapse in our governmental funding. Unfortunately, because of where we are in the process, we are very likely to see additional continuing resolutions. And as you both know, it is impossible to plan for or to budget money for future disasters if you are only using a continuing resolution process, because by its very nature, that is a process where you only look back and fund the activities of the previous year or years, not what is going to be happening in the future. So I certainly hope that we, and I'm sensitive to the fact that our ranking member of the full Rules Committee is an appropriator. So I want to be careful what I say, but at the same time, we really do depend upon the appropriations process to do their work. And then, of course, we will do our work in the Rules Committee when they finish their product. But here we are. We're in the largest and most devastating pandemic, and certainly in my lifetime. In fact, I serve on another committee that has jurisdiction over pandemic preparedness. That's the Committee on Energy and Commerce. And I've been asking our committee, the Committee on Energy and Commerce, to hold just such a hearing for certainly longer than a year, probably almost 2 years. And recently I sent a letter to Chairman Pallone of the Committee on Energy and Commerce expressing my frustration and disappointment with the lack of response from the Energy and Commerce Committee, which is one of the primary committees that should deal with public health. I think we have much to learn from the experience that we've all been through the past 2 years, but our committee has been, the Energy and Commerce Committee has been eerily silent, and it is a point of personal frustration to me that the Energy and Commerce Committee, which has a responsibility in this area, really has not shouldered that responsibility. And this is not just a criticism of the majority Democrats. I think that criticism actually applies to both sides of the dais. I cannot believe how passive we have been on the Committee on Energy and Commerce as far as asking the hard questions and providing information as an authorizing committee to our appropriators, and then ultimately to the Rules Committee before a process comes to the floor. It has been extremely frustrating to be in the minority during this pandemic, but it's also extremely frustrating to be part of a committee that should be in the vanguard, should be in the lead, and in fact has not even shown up. So the Energy and Commerce Committee reauthorized a bill. It was called the Pandemic All Hazard Preparedness Act of 2018. And this very situation, it is what we were aiming to prevent and for which we were attempting to be prepared. And I believe that we can all agree that we have had many successful accomplishments from the Pandemic All Hazard Preparedness Act. The one thing that it should have done, which was prepare us for this pandemic, it did not do. And again, going to my previous frustration, we had no real time, no actual hearings as an authorizing committee on the Committee of Energy and Commerce looking at this in real time, while the drama was unfolding around us, we had the Pandemic All Hazard Preparedness Act signed into law in June of 2019, 6 months later to be visited by this pandemic. And we never asked a single question. Did we get it right? What could we have done better? What should we learn for next time? So it's not often that we have a real live case study to intricately examine the effectiveness of the policies that we just passed. And many of us, those of us who are witnesses today and those of us on the legislative side, we've had some experience with this over the years. One significant success that did occur during the first year of the pandemic, a significant milestone of the previous administration, the Trump administration, was that of Operation Warp Speed. Because of this program, we have access to vaccines, we have access to effective therapeutics, and the very existence of those vaccines and therapeutics begs the question, what made Operation Warp Speed so successful? And are there ways that we can apply these successes to our government's regular duties so that we don't just have to respond at the time of an emergency? It's critically important that we take the time to examine the program while we still have an opportunity to speak with those who developed and deployed it, those who were on the front lines, those who lived it. And so for that reason, we're so very fortunate to have Dr. Kadlec at our witness table today. Additionally, it's an opportune time to compare our nation's response to the novel coronavirus to other pandemics that we've encountered. For example, while on different scales, the Ebola outbreak that ravaged Western Africa in 2014 and 2015, in fact, made its way to this country and ended up in my backyard in Dallas, Texas. It took 5.5 years for an Ebola vaccine to be developed and produced and receive emergency use authorization. That's why the stunning success of Operation Warp Speed, standing in stark contrast, where over a 9-month period, we had the streamlining of the process at the emergency use authorization process at the FDA and got that vaccine in the hands of our constituents. Furthermore, I think it's pertinent to learn about what we're currently doing in the current administration to further the progress, the success of the previous administration's pandemic response. We also must determine exactly where the almost $5.5 trillion that Congress has appropriated for these efforts, where are those dollars today, which have been spent and what remains unspent? And when we talk about further activities, we really can't authorize new spending. We can't appropriate new spending until we know where the last dollars have gone. Effective oversight is going to be a key component of any successful pandemic preparedness and response effort. And in fact, we really can't talk about how we budget for future problems if we don't understand where the dollars went, where the successes and the missteps were in the last effort. Plain and simple, we really can't plan for future pandemic preparedness unless we have a strong understanding of what has worked and what has not worked. We find ourselves in a unique and really a historic position. While these past 2 years have been exhausting for Americans, now's not the time to just sit back and hope that we won't find ourselves in a similar crisis in the future. This will be our best opportunity to create strategic and smart policy that will help ensure that the next time this occurs, the country is properly prepared and that preparation can be properly executed. Thank you, Mr. Chairman, for holding the hearing. Thanks to our witnesses, and I'll yield back.
Thank you, Mr. Burgess. I appreciate your comments about energy and commerce. I do want to note, though, that while the pandemic is, in the center here in terms of our thinking, that more broadly, I also want to deal with the notion of other natural disasters, which may be regional, whether it's wildfires, et cetera. and whether or not our budget process is prepared to deal with that. So I appreciate your comments. I also want to thank Chairman McGovern, who's been working with our subcommittee to host this hearing, and so appreciate your comments. As for the appropriations process, I don't have the privilege of serving on the Appropriations Committee, but I would note that the House is, I think, done a great deal, and we're waiting for our brothers and sisters across the Capitol, as we do on many issues. But with that, I'd like to introduce our witnesses. Let me begin with Dr. Helene Gale, who's been President and CEO of the Chicago Community Trust, one of the nation's oldest and largest community foundations since October 2017. Under her leadership, the Trust has adopted a new strategic focus on closing the racial and ethnic wealth gap for the Chicago region. For almost a decade, Dr. Gale was President and CEO of CARE, a leading international humanitarian organization, an expert on global development, humanitarian, and health issues. She spent 20 years with the Centers for Disease Control, working primarily on HIV/AIDS. She worked at the Bill and Melinda Gates Foundation, directing programs on HIV/AIDS and other global health issues. Dr. Gale was born and raised in Buffalo, New York, which, as a upstate New Yorker, I have special pride in knowing that. She earned a BA in psychology at Barnard College, an MD at the University of Pennsylvania, and an MPH at Johns Hopkins University. We're also joined by Julia Tedesco, as the President and CEO of FoodLink, a not-for-profit dedicated to ending hunger and building healthier communities in the greater Rochester Finger Lakes region of New York. Over the past decade, she has led the organization's evolution from one of the country's oldest food banks to an innovative food resource center and public health organization focused on addressing the root causes of food insecurity, including chronic poverty and systemic racism. Ms. Tedesco began at FoodLink in 2008 and has served in numerous roles for the organization. She was named Executive Director 2014. Ms. Tedesco holds a master's degree from Syracuse University's Maxwell School of Citizenship and Public Affairs and a bachelor's degree from Fairfield University. And I have had the privilege of working with her on a number of issues back in my hometown. Jeff Schlegelmilch is the Director for the National Center for Disaster Preparedness at Columbia Climate School at Columbia University. In this role, he oversees the operations and strategic planning for the center. He also oversees projects relating to the practice and policy of disaster preparedness. His areas of expertise include public health preparedness, community resiliency, and the integration of private and public sector capabilities. Prior to his role at Columbia, he was the manager for the international and non-healthcare business sector for the Yale New Haven Health System Center for Emergency Preparedness and Disaster Response. He was also previously an epidemiologist and emergency planner for the Boston Public Health Commission. And finally, Dr. Robert Kadlec previously served as Assistant Secretary of Preparedness and Response at the U.S. Department of Health and Human Services from August of 2017 through January of 2021. Dr. Kadlec spent more than 20 years as a career officer and physician in the United States Air Force before retiring as a colonel. Over the course of his career, he has held senior positions in the White House, the United States Senate, and the Department of Defense. So thank you all again for joining us today, and we'll begin. Dr. Gale, if you're recognized to share your testimony with us.
Great, good morning, and thank you, Chairman, and the other members of the committee and the subcommittee on the opportunity to address you on this incredibly important issue. I won't go over a lot of the statistics around this COVID pandemic. I think we know them well. And while the health and economic consequences of COVID-19 are unlike any that any of us have seen in our recent memory, it is likely that this is not going to be a once-in-a-generation pandemic. We know that more than 40 new infectious diseases in humans have emerged in the past decades. You've mentioned some of them: SARS, MERS, Ebola, Zika, etc. So we know that we are at a time when we will continue to see new infections that can lead to global pandemics, as we're seeing now. Clearly, we have to take the lessons that we have learned and think about how we apply those not only to this current crisis, but in ways to make us better prepared. And while we know that we will continue to have these new infectious diseases emerging and pandemics, how we respond to them will really determine whether or not we see the kinds of severe health and economic consequences that we are seeing today. So let me just um, lead off with 5 points. First, pandemics do play on social fault lines and will always impact the most vulnerable in our societies. COVID-19 has highlighted how the social determinants of health and underlying root causes that make one vulnerable to poor health also further amplify health and economic inequity. Pandemic preparedness means focusing on how we prepare for economic stability and resiliency, not just in the face of a crisis, but also in normal times. This requires us to think about how we address issues like affordable housing, the social supports we provide to individuals and family over the long term, like paid sick leave, family leave, living wages, affordable, accessible, high-speed internet, and comprehensive affordable health insurance. Pandemic preparedness can and should help us to reimagine how we deliver social and economic support to make sure that we are all as a society resilient in times of crisis. Number 2, we must work with communities that are most impacted, establishing links to organizations and people who are trusted. Another important lesson we learned during COVID, as we have during other crises, is that to address the public health needs of people, we must work with the communities that are most impacted, who often have less access to services and less faith in medical systems that have failed them in the past. It is critical that public health institutions develop relationships with trusted messengers in order to deliver life-saving measures like vaccines. These organizations and people who have been with communities and have stood the test of time are the ones who are going to be most effective, particularly when residents are grappling with the impacts of crises like this pandemic. Third, pandemics do not know geographic and political boundaries. A go-it-alone approach is ineffective and counterproductive to preventing and addressing a global pandemic. While clearly preparing for future pandemics at home and strengthening our own health safety network are immediate priorities, we cannot afford to ignore global health security vulnerabilities. There are no boundaries to global pandemics, and attempts to isolate populations, like closing boundaries, are not only ineffective but counterproductive as we work to look at a collaborative and cooperative way that is critical in addressing global pandemics. And we have seen time and time again in this pandemic that no one is safe unless we are all safe. As the richest nation in the world and a leader in global health and development assistance, we must provide international assistance to address pandemic prevention and control globally, especially for under-resourced nations. This is not a matter of charity, but a strategic investment in US and global health security. We need to think about models like PEPFAR and global health security and control and prevention of diseases in the ways that we have in the past, because it is critical to our strategic health diplomacy, our investment in foreign policy, our national security, and our economic interests. Fourth, pandemic preparedness is as important but underfunded as compared to investments in other major threats, as example, our preparedness in military readiness. Knowing that future pandemics are a serious security and economic threat, the government must commit to investing in prevention, detection, and response to protect vulnerable populations from future infectious disease outbreaks. And if you compare our spending, our military spending, as an example of $750 billion, compare that to $447 million that we use for preparing for global health security threats like COVID. And while those aren't exact comparisons, if we think about the fact that our future threats are more likely to be in the cyber arena and the biologic arena, we need to think about the magnitude of spending that we commit to health and health security, and particularly thinking about making sure that the organizations like the CDC, the NIH, the FDA, State Department, and USAID are adequately funded in advance to be able to be ready when and have systems in place when the next crisis does occur. And finally, 5, maintaining public health infrastructure, including a well-trained and robust workforce, surveillance systems, laboratory systems, information systems. All of these things are key, and we should have learned this from the HIV pandemic, Ebola, SARS, etc. We know that the public health workforce has been shrinking and is estimated to shrink dramatically. Leading up to the pandemic, there were approximately only 56,000 public health workers due to funding issues. Access to public health workforce interest and needs survey shows that a large proportion of workers are considering leaving their job in the next year due to inadequate pay. We must make sure that we don't continue to lose the critical infrastructure of people, surveillance system, and laboratory capacity that is necessary and needs to be in place in order to be prepared. The budget for the hospital preparedness program, the major source of federal funding to help regional healthcare systems prepare for emergency, was only 275 million in FY20. That's just half over what it was in 2004 of 515 million. So, we have almost halved the dollars that were available for hospital preparedness over the course of the last few years. These are just a few examples of how the decline in funding has led to us being caught off guard for this pandemic, not prepared and not having the infrastructure in place. And so, my overall message is that we need to make sure that we have in place the important systems, people, relationships, and commitment to be able to be prepared the next time. We've learned these lessons. We should have learned these lessons. We have a lot of blueprint to go on, lots of information and lots of lessons learned from the past couple of decades of fighting global pandemics. We need to learn these lessons. We need to keep the infrastructure in place. We need to be prepared so that we don't have to suffer the consequences that we have during this global pandemic. Thank you.
Thank you, Dr. Gale. I appreciate your comments, and I'm sure people will have a number of questions. And with that, Ms. Tedesco, you are recognized for your testimony.
Thank you, Chairman Morelli, Ranking Member Dr. Burgess, and members of the Rules Committee. Good morning, and thank you for the opportunity to speak with you today. My name is Julia Tedesco, and I have the great privilege of serving as the president and CEO of FoodLink, a nonprofit organization in Rochester, New York, that serves as the regional food bank. Congressman Morelli likely recalls attending FoodLink's very first COVID emergency response food distribution on March 20th, 2020 in his hometown of Irondequoit. There was a lot we didn't know about COVID then, but as an emergency response organization, we knew that families were already struggling with hunger and access to food as they do in the face of any crisis. That day, a collaboration between the nonprofit and government sectors enabled us to safely get food to more than 300 households. In the 2 years since, we've organized more than 900 similar drive-through emergency food distributions across our region. In the next few minutes, I'd like to first share details about FoodLink's response during this pandemic. And second, I'd like to talk about the critical role that nonprofits play and why investment in this sector will help prepare us for any future emergency response. In doing so, I'll do my best to represent the 200 plus Feeding America food banks across the nation that have responded to COVID-19 and countless other disasters. Much attention has been given to the pandemic's devastating impact on the food security of millions of families and how many Americans were one crisis away from not having enough food to eat. We saw this firsthand in the city of Rochester and in the suburban and rural communities throughout our service area. We saw that as many as 40% of the people seeking support from the emergency food system were doing so for the very first time. But we also saw firsthand how this pandemic disproportionately impacted the vulnerable, the elderly with limited incomes, low-income parents, people of color, and so on. Individuals who are already facing difficult choices like paying for rent or paying for food. Individuals for whom panic shopping in bulk for groceries was simply not an option. At the same time, schools closed indefinitely. The city of Rochester has one of the highest child poverty rates in the nation, every student in the district is categorically eligible for free school meals. With schools closed, parents were left wondering how to account for 2 extra meals per child per day, a looming financial and public health crisis of its own. Foodlink sprang into action on both fronts. In response to the need, we, within a matter of weeks, established a temporary alternate offsite warehouse to safely store and pack emergency provisions. When most of our network of direct service partners, think of food pantries and community centers and meal programs in church basements, were forced to shut down, we designed and coordinated no-touch drive-through distributions in centralized locations across 7,000 square miles. When government and community partners had critical information or supplies they needed to get to the public, we utilized these distributions to disseminate them. We became a central hub for everything from suicide prevention and mental health resources to US Census data collection. When a nurse from our regional healthcare system called us to frantically figure out how to get food to an elderly, quarantined, immunocompromised patient, we, for the first time in our 40-plus-year history, made a home delivery and continue doing so thanks to partnerships with other nonprofits. We sat with leaders from our local city school district to brainstorm and coordinate the logistics of 17 grab-and-go meal sites for kids and their families. Understanding that barriers still existed for food access, we repurposed some of our smaller box trucks, and thanks to waivers issued by the USDA, we implemented ice cream truck-style neighborhood meal distributions to complement our summer meals program. Foodlink distributed more than 50 million pounds of food in the last 22 months, and our kitchen produced more than 1.5 million healthy meals and snacks. Our fellow food banks in New York State and around the nation all did similar work, distributing unprecedented amounts of nutritious food, leveraging our relationships in the communities we serve, our expertise in food distribution, and our infrastructure, including distribution centers, industrial freezers and coolers, commercial kitchens, and fleets of trucks. Significant government interventions such as child tax credits and boosts and SNAP benefits helped quell what surely would have been devastating poverty levels. Still, food insecurity remains approximately 10% higher than levels recorded in 2019. That's more than 7 million people across our nation who are food insecure, and in our region that equates to about 152,000 people who have limited access to food. 152,000 people who might not know when or from where their next meal will come. As a food bank, we're proud of our response to this pandemic, but it is important to emphasize that for every 1 meal that a Feeding America food bank like Foodlink provides, SNAP provides 9. If we are to make a meaningful reduction to hunger in America and address a compounding factor in any disaster or crisis, the federal government must continue to increase investments in anti-poverty programs like SNAP, and to think of this in its own way as a form of disaster preparedness. In addition to investing in the social safety net, the federal government should more significantly invest in the nonprofit sector's ability to respond to crises. Nonprofits are not merely a group of small charities trying to do good. We are oftentimes the engine that generates innovative solutions to complex problems in our society. When the government needed to find ways to distribute food, PPE, vaccines, and information into underserved communities, it relied on the infrastructure, expertise, and flexibility of community-based nonprofit organizations. Far too often, though, nonprofits like Foodlink are asked to execute on programs that we did not have an opportunity to weigh in on. Issues with the coronavirus food assistance program have already been well documented, and I won't go into all of them here for the interest of time. But I do hope a major lesson from CFAP is that when the federal government needs to find ways to help feed people, it should include, or perhaps begin with, the nonprofit sector, and specifically the expertise of the Feeding America network, rather than to recreate the wheel. This nation already has a centralized hub for emergency food assistance with spokes across every state, county, and local community in America that could have helped to ensure smoother logistics and more equitable access to these food boxes. If food banks were included from the start and leveraged for their expertise, we could have significantly reduced staff time spent on coordination, saved dollars, and fed millions more Americans. I hope that a critical lesson to come out of the pandemic is the importance of investing in nonprofit infrastructure and technical capacity. Over the last couple of years, we often found ourselves with a strong food supply, but insufficient cold storage and refrigerated vehicles. Foodlink has had rented tractor trailers stationed in our parking lot running 24/7 for 2 years to provide additional cold storage. Community-based nonprofits do not have the resources to do R&D and invest in innovation the way that the private sector does. And when we do, it rarely, if ever, is funded by the federal government. We are encouraged by the USDA's promised investments in strengthening our food system and hope these investments extend beyond farmers, producers, and for-profit distributors to include the nonprofit sector. To summarize, we first and foremost believe that our nation's social safety net must be strengthened to better prepare us for the next disaster. But the pandemic has also shown us that the federal government has a real stake in the operational efficiency, infrastructure, and capacity and innovation of the nonprofit sector, especially when responding to disasters. This sector should be invested in, and nonprofits should be counted on not only to receive support and deliver interventions or services decided on by government, but to take part in the very design of those services. Thank you for your time today.
Thank you very much for your testimony. And now, Mr. Schlegelmilch, you are recognized for your testimony, sir.
Thank you. Thank you, Chairman, and thank you to all of the members of the committee for the opportunity to speak with you today. To complement my written testimony, I want to talk about a few experiences in the field that sort of illuminate what these larger challenges look like. So to start, actually, after Hurricane Harvey, my colleague and then director of the center, Erwin Redlener, and I were in Texas assisting some celebrity donors to identify where their money could do the most good. And we saw a range of things from really emergent community organizations that maybe never envisioned themselves being part of disaster response and were meeting unmet needs, needs that weren't being met by larger sort of external groups, or maybe that the funding couldn't reach. But in particular, what stands out is a faith-based group that was doing what we would call disaster case management. So there were a number of people who were being denied assistance through various programs. And a lot of times they were actually eligible, but had filled out the paperwork wrong or misunderstood a definition or something like that. And so what most of them did was they gave up. And so they went to these nonprofits, and they actually helped them reapply and get access to those resources. In other cases, maybe they weren't eligible, but they were eligible for another program they weren't aware of and wouldn't have thought to look, like the Small Business Administration. Zooming out a little bit, I was talking to a state mitigation officer on some of the new mitigation funding that was coming in, and he was lamenting about how a lot of the smaller, more marginalized communities just had no way of accessing and putting together the application for these. That the opportunity to waive federal cost share was great for the communities that had capacity but not resources for cost share. But a lot of the most marginalized groups really lack the administrative capacity. And for folks like you and I that are mired in paperwork day in and day out, the idea of another grant may not seem too daunting, but a mitigation grant is quite a daunting task and requires a high level of administrative sophistication that many simply don't have. So we see a pattern here with the increased complexity that it sort of pushes out those who are already the most marginalized. I tend to say those who have access to the benefits of civil society before a disaster have access after. Those who don't have lawyers and accountants and access to high quality administrative frameworks often don't have access to what are otherwise deemed fair and open. Accessibility, fair and open in theory, does not actually equate to fair and equal in practice with these barriers in place. So thinking about root causes and something to talk about in my written testimony. So I had a call a couple of months ago with a congressional office, and it's the same call I get from various offices on all sides of the aisle from time to time after there's a major disaster. And they say, we want to know how to do a better job with response. What are some things we can do? So I start going down my list, which is suspiciously similar to my written testimony, and talking about consolidating and simplifying and really looking at sort of larger sort of muscle movements in our whole of government disaster response. And I'm typically met with, yeah, we can't do that. Yeah, that's not going to fly. No, there's no way we can get that approved. In the current climate, we'd love to, but we can't. And then it settles in on this comment, we're looking for a quick win. We're looking for a quick win. And then the comment kind of gets cleaned up with something that can lead to more, something that can be a starting point, and all of these things. In the opening comments from the chairman, I know we talked about the complexity of disaster response and the sheer number of programs and agencies. It's important to note these quick wins are quite literally killing us. They are creating layers upon layers of complexity to the disaster response. And it requires more and more workarounds with emergency supplementals and budgetary workarounds, which creates a cacophony of data and assistance that leaves the survivors, the only ones who can access are the ones with the highest capacity and likely to be less vulnerable to begin with. So to close, I want to reiterate a couple of the key recommendations I had in my written testimony. One is I know it's pretty on brand as an academic to say we need better data and more analysis, but we need better data and we need more analysis. We know enough to know in broad strokes that preparedness saves, and some of these specific programs we know, but to really look at this across whole of government and look at what is going into preparedness through the true definition and what is going in response. We actually don't have enough information to get from this concept and general direction to be pointed in to start answering questions. How much? What are the details? What are the investments? And what is the value of those investments? And what are the payoffs in terms of equity, social good, financial good? We have rough ideas, but not necessarily to the level of granularity to integrate into a lot of decision making. We need enhanced guardrails, quite frankly, to prevent electoral incentives that are contrary to the public interest from dominating legislative and budget processes. The political science points towards faster and very voluminous relief and recovery funding. Relief and recovery funding is necessary, but the signals for preparedness funding are virtually non-existent. But in disaster science, of course, we know those are the most valuable, and that's how you prevent loss of life and livelihoods in the event of a disaster. We desperately need to simplify disaster funding and assistance and the bureaucratic landscape for all of this. It's a very unappealing and complicated topic, but I think it's probably the single most important thing that could be done to set a landscape that's more conducive towards disaster assistance benefit and equity. And finally, I haven't mentioned this yet in my verbal comments, but we need to look hard at the public servants who are carrying out these policies and make sure we're making investments in their development. The world is changing. We know this. We know that our structures need to change, but these structures ultimately translate into institutions and people. The investment in professional and organizational development often gets thought of as overhead. It needs to be an essential part of the cost of doing business to ensure that those that are engaged in the design, development, and implementation of these strategies have the support that they need to accomplish, which they are already working so tirelessly and admirably at every day. So with that, I want to thank you for your time, for the opportunity to speak, and I look forward to any questions and the opportunity to discuss further. Thank you.
Thank you so much for your testimony, and I'd like to ask Dr. Kadlec to provide his testimony now, sir.
Thank you, Chairman Morelli and Ranking Member Burgess and other members on the line today. Thank you for the privilege of and the opportunity to appear before you as a private citizen. As the HHS Assistant Secretary for Preparedness and Response at the start of the pandemic, I lived, breathed, and bled the experience. I certainly want to acknowledge the incredible work, service, and sacrifice of the federal, state, local, tribal, and territorial civil servants and professionals from the private health sector that served as the first responders in this pandemic response. The whole of nation response has been vital to preserving our society and saving lives. I also want to commend you and your colleagues for your strategic vision and foresight in having this subcommittee consider budgetary approaches that Congress could take to prepare the country for the next pandemic or major public health emergency. I'm convinced by these collective commitments to learning from the COVID response and to future congressional action that we can better prepare to mitigate unnecessary loss of life, negative economic impacts, and societal disruptions that another pandemic will bring. There are several historical and contemporary budget approaches that worked, did not work, and could work better. There's some prospective ideas that are innovative and I think would work to improve future pandemic preparedness. Whatever approach taken must address a range of potential health security threats, to your point, Mr. Chairman, and ensure congressional accountability and sustainability of critical response capabilities. What worked? Project BioShield Act that was created by Congress in 2004 after the events of 9/11 was an effective tool. It created a 10-year advanced appropriation to incentivize the development and procurement of chemical, biological, and radionuclear medical countermeasures that did not have a commercial market. The program was successful, but the special reserve fund created by legislation was not replenished when the original 10-year appropriation ended. Advanced appropriations could be useful in developing pandemic and antimicrobial medical countermeasures, as well as CBRN ones. The dilemma becomes renewing such advanced appropriations and the potential that Congress may later choose not to do so. The original BioShield concept called for obligatory, non-discretionary funding. What didn't work? Funding preparedness with periodic disaster supplementals. Uh, Funding to sustain improvements in preparedness are not particularly useful tools. And quite frankly, with the mainstay at ASPR, I have a chart of historic budgetary, of ASPR's budgetary history that indicate that the majority of funding that we received for our role was oftentimes through supplementals from disasters. While they've been significant enablers for preparedness, but when these funds basically expire, as they did with influenza and Ebola ran out, our ability to sustain programmatic funding for pandemic preparedness and particularly countermeasure development and some of our practical capabilities, operational capabilities, such as our NDMS, National Disaster Medical Teams, were jeopardized. For example, when I arrived at ASPR, our NDMS teams had not received any sustainment or specialized training for several years. Now, fortunately, but unfortunately, because of the hurricane supplemental generated after the Hurricane Harvey, Irma, and Maria, we were able to fund highly infectious disease training for our NDMS teams before the pandemic. Looking ahead, periodic pandemic or disaster supplemental funding will not support the desired long-term countermeasure development, medical response, or hospital preparedness, or similar programmatic preparedness initiatives that the nation needs. What worked but could work better? Well, the CARES Act worked fabulously. The Coronavirus Aid Relief Economic Security Act worked, but the delay in securing the funding through the supplemental process slowed our ability to respond. And quite frankly, delayed our ability to procure personal protective equipment at a time when cash in hand was able to buy available limited PPE supplies. It also delayed our ability to contract with pharmaceutical companies for the development of COVID-related vaccines, therapeutics, and diagnostics. What could work with the right safeguards and provisions? Appropriating funds into the existing Public Health Emergency Fund found in 42 U.S. Code Section 2247D that enumerate powers and authorities of the Secretary of Health and Human Services. This cannot be a generalized health slush fund. It would be used by the Secretary specifically to address the risks of a pandemic or catastrophic national public health emergency, such as a large-scale cyber attack affecting public health or healthcare, or a large-scale CBRN event. The last area that I would identify is things that have been identified as prospective ideas, and that is really the idea of somehow circumventing or exempting designated preparedness funding from budget caps, which I believe is an excellent idea and is an idea supported by the Bipartisan Policy Center. And I think that the idea of creating a permanent budget designation for programs deemed highest priority to prevent, detect, and address infectious disease threats outside the annual 302 allocations and outside the overall budget limitations would be something that would be extraordinarily beneficial. And finally, with time running out, I would just say that there needs to be some kind of mechanism to support the strategic national stockpile, and that should be studied and evaluated. The SNS has consistently been tasked to meet more hazards than its funding has allowed. Congress should specifically identify which hazards the SNS should be prepared to encounter over the next 5 to 10 years and authorize an appropriate commensurate budget to meet those requirements. When it makes economic sense to permit the SNS to rotate certain stock before expiry, possibly through vendor managed inventory, to save the government and American taxpayers significant funds. And ideally, Congress should identify a mechanism to enable better preparedness, not only for federal level, but the opportunity to procure personal protective equipment by our non-federal partners at the state, local, tribal, and territorial levels. With that, sir, I'll end my comments and look forward to your questions. Thank you very much.
Thank you, Doctor, and thank you for your service to our country in the number of different capacities you've held. We appreciate that very, very much. I'm going to just, if I can, ask just a handful of questions in the first round, and then I want to make sure my colleagues all have an opportunity to ask questions, and I may come back for a second round if that's acceptable to folks. I want to start with Dr. Gale and Ms. Tedesco, both of you representing the not-for-profit sector that did so much over the last year and continues to do so much. So, and perhaps Dr. Gale, if you could respond, and then Ms. Tedesco. But I sort of think about sort of three things. First of all, is there enough local planning and coordination being done in Chicago and Rochester, and I'll take those two data points to sort of reflect on what it's like in the country. So in Chicago, for instance, are you routinely going through with other community partners and local government a planning process, a coordination on what would happen if? And the same thing I would ask of Ms. Tedesco. Second, if not, if we're not doing enough, how could we help incentivize that local coordination, drills, planning process, et cetera? And finally, and I think Ms. Gale mentioned this in your testimony, the idea of not enough money for not-for-profits prior to, and maybe it was Ms. Tedesco actually who mentioned this. So if there were additional dollars, what would not-for-profits do with those dollars in pursuit of greater resiliency? How would they be technical? How would you actually use those things? So those are sort of just initial questions. If perhaps Dr. Gale first, and then Ms. Tedesco.
Great, thanks so much. So your first question around the coordination, I mean, I think that clearly much more coordination needs to occur, and I think the link is from the federal to the state to the local, and then working at the local level with nonprofits that work directly with communities. And I would say, if I look at the situation here in Chicago local public health department um, had done a lot of preparedness and had in fact been doing drills and looking at tabletop exercises and other things, understanding that preparedness for the next pandemic was critical. That said, that isn't necessarily going on across the country, and the resources that need to flow from federal to state to local have not been there historically for preparedness, so that when something occurs, those systems are in place. And I think we saw in the beginning of this pandemic a real disconnect between, for instance, our surveillance system, our ability to even know what was going on, because we weren't adequately funding it so that those dollars did flow from federal to state to local. At the local level, I go back to a lot of the experience I had when we were focusing on the HIV/AIDS pandemic. We funded at the federal level directly community-based organizations that really built the kind of infrastructure to reach communities that were at greatest risk. But a lot of that funding dried up, and it didn't maintain some of the kinds of networks that were necessary at the community-based level. So we have seen through this pandemic a rebuilding of a lot of that. We're working here at Chicago. We are helping to coordinate a Chicago vaccine partnership that is really looking with the organizations that can reach the hardest to reach communities, particularly Black and Latinx here in Chicago. But that has all had to be rebuilt. And, these are the kinds of things that could stay in place, because these are the same community organizations that are meeting people's needs in different ways. And they can be ready to be mobilized, but we had to do a lot of rebuilding to put those community partners in place and to make sure that the health department and community-based organizations were working in tandem. And so, I think the message over and over again is that we know how to do it, and we know the organizations that can be incredibly effective at the grassroots and the community level, but we don't continue to resource them so that they're, that we have this functioning, seamless system that flows from federal to community-based level.
Thank you for the
Yeah.
question, Chairman, and I agree with Dr. Gale's response. I think there is a disconnect between emergency planning and disaster preparedness at the government level, and then at the local and community-based level. On Food Link's part, we have been involved at various times with VOAD, voluntary organizations active in disaster, but what we've seen is that there's been fits and starts of that, and at the state level, when you look at who manages disaster preparedness and how that flows, it's incredibly complex, and it does not translate to how we work at the ground level, and does not sort of honor the, the knowledge that we have and the relationships we have in the community. So I don't know if this is a recommendation per se, but I think what needs to happen is that we need to begin to speak the same language, that the government needs to come to the table with community-based organizations who end up delivering those disaster response services, and come to the table as equals in terms of planning, because what exists at the government level, what we've seen is a series of flow charts and complexities, and what exists in at the local level is just an understanding of what people need and what our peer nonprofits can offer. And communications is key. We saw that in Rochester, is simply having the structure. We immediately, thanks in part to you, Chairman, we're able to have these weekly emergency response calls with government entities and nonprofits and the for-profit sector. That made all of the difference. It made us nimble. It made us be able to respond quickly. So more than anything, having the communication structure in place. But to answer the second part of your question, yeah, it's truly capacity building. Someone else touched on this earlier, but and I'm sure you've all heard this before, but far too often, for nonprofits have the opportunity to apply for federal grants for really prescriptive programs, or even from private funders. They want to fund a feeding program for children over and over, and I certainly understand why. But what they don't want to fund is the technical capacity building, the staffing, and certainly I think what is lacking is thinking about all of that in the context of planning for a disaster. Food banks know how to distribute food. Do they all have generators? Do they all have the cold storage that is required? Right now we're facing supply chain issues with trucks. We have a truck shortage, we have a truck driver shortage. So that type of investment is what could make a huge difference for us.
I do want to, and I'll just editorialize, because in Rochester, as Mr. Tedesco's pointing out, we at the beginning, I think we organized twice a day phone calls with groups that included Food Link and others, but we were really making it up as we went along, and I'm just sort of thinking about how we might better incent local communities to do that on an ongoing basis, so that they're basically, I used to say there's no real manual locally on what we do in the middle of this, so we're just making it up, sort of building the airplane as we're flying it. But it would be interesting to me whether there's a way in partnership with the federal government to start incenting local communities to go through that process and that exercise in advance of having a real live event. I just want to switch, Mr. Schlegelmilch, you said something that has been the bane of my public existence, which is whenever I'm at a table and people say, let's get some quick wins. To me, in my brain, what that means is let's do the easiest things so we can show everybody that we're doing things. But rarely have I ever seen quick wins turn into any lasting value. In fact, I think it almost undercuts. So I'd ask it this way: what kinds of things should we do to develop some slow wins or some wins that are lasting? And you started to touch on it a little bit, but and maybe even use the frame of making this easier for people. I thought your comments also about how difficult it is if you're already in a sense disenfranchised prior to a crisis, you're not going to be any better able or better equipped to deal with it during the crisis. So if you could just expand on that a little more, I thought that was very interesting. What should we be doing to think about that differently?
Absolutely. Thank you for the question. I think, so I'll answer it two ways, sort of from the bottom up. I think the first thing we have to think about is really what are the transactions that we're asking people to engage within in order to access different kinds of assistance. If you're a survivor at the individual level, if you're a nonprofit within a community, and what are the strings attached to that? Now, obviously, it runs through filters at the state and local level that this committee might not necessarily have direct oversight of, but certainly originating from the federal level. And so that's where there's an obvious answer, but not an easy one to implement, which was simplification. That sort of these quick wins layering on top of each other. I reference in my written comments a federal colleague who calls it the Jenga of federal assistance, topping one block on top of the other in random arrangements, and seeing how that really affects those and what capacities are required to access that and who has them and who doesn't. Honestly, in the meantime, a stopgap may be to provide technical assistance to communities to put grants in place, or to increase funding for disaster case management until the larger paradigm can be simplified. And that leads to sort of broader topics, which is that really taking a step back holistically and looking at this. I mentioned the data. So a couple of years ago, the conversation's still going on, but it sort of broke through in my world, where a number of former senior federal officials were talking about how states need to do more to invest in preparedness, and rules should be changed to really putting a lot of the burden on this is because states aren't investing in preparedness, and they are the Stafford Act incentivizes not investing because you can get 70%, 75% federal cost share through a disaster declaration. There's probably a bit of truth to that, but I'm bringing this up because the Pew Charitable Trusts, through their Fiscal Federalism Initiative, did a survey of states on their investments in preparedness, and it turned out there was no standard metric for measuring preparedness. States didn't have a standard way of doing this. And so the self-reported data ranged from very little to a whole lot to non-respondents because they were responding to active disasters. So I think also as a consequence of quick wins, we have information that's spread out across many different points that can be neatly pulled together to form a narrative for an argument, but a really sort of systemic analysis. We and my colleagues at Georgetown put together some analyses on some very specific elements of emergency supplementals, and even there, we admittedly there are things that there are blind spots to with different changes in rules and things like that. So I hope that's somewhat helpful. But I guess at the ground level, really be very sympathetic to the transactions we're asking people to engage in to access resources, and recognizing that can be a critical barrier. And in the formulation of these, really looking at whether or not this complexity ultimately serves or hides a lot of actions that are ultimately detrimental to the broader goals of resilience building.
Well, and I won't bore you with my long seminar on how we should better integrate social, health, and educational and governmental services just in general, absent a natural disaster. But and Ms. Tedesco and I are part of an effort back in Rochester to integrate those services. But at some point, I may come back and talk to you more about that subject. Just if I can, to Dr. Kadlec. So we've hearing from local community organizations about what they experience in terms of coordination. I'm just curious, and this is, I'm not someone who's very interested in the past, except what we can learn from it. But from your vantage point, the notion that there were so many different agencies involved in this, did you feel frustrations, and is there a way to better organize and coordinate at a high level, at the federal level, our response in times of either natural disaster or things like the pandemic?
Sir, there is a mechanism that exists through FEMA with the use of the VOADs. I think Ms. Tedesco kind of raised that up as one thing, and that is through the FEMA regional offices where they collect them. Now, I think practically speaking, in the nature of a pandemic, which really required a different set of players to work in different contexts, that's, I think, one of the issues that I think that was brought up by Dr. Gale, that there is this need to really drill and exercise. In my testimony, I have a piece that says, whatever we do, we need to commit to that at a federal level. And we did do that at Crimson Contagion. We actually did do a local state. We worked with a number of different states, Illinois being one, Chicago being a city, where we looked at the ability for pandemic preparedness, but that was the first time it was ever done. And this is something that has to be drilled regularly, in some kind of regular basis, ideally like every 3rd year. So every administration gets a chance to go through that experience, but more importantly, to do it with different parts of the country and really get down to the community level and exercise it so that we can get people like Ms. Tedesco talking about the food bank. We can get other elements of the local community outreach programs to make sure that those who are not easily reachable or who have challenges in being reached or the equity issues can be identified and effectively addressed. We did do that in our efforts with Warp Speed, working with the Warp Speed team, the logistical team, and with CDC and state and locals. But that's something that has to be done, I think, drilled regularly to make sure that not only the muscle memory, but the people who are actually holding those positions, which oftentimes changes every couple of years, are refreshed and again trained and educated.
Thanks for those comments. I'm going to reserve more of my questions, but I want to give my colleagues an opportunity, and they have very demanding schedules. So I'm going to go first to you, Dr. Burgess, for any questions you might have, sir.
Great. Thank you, Chairman Morelli. And like you, probably divide my my questions up into two sections to give other colleagues an opportunity to talk to our excellent panel this morning. Dr. Kadlec, I do want to reference one thing you mentioned in your written testimony in speaking with Crimson Contagion, the exercise that you did. You have the statement here. In fact, barely a month later, we hosted several dozen congressional staff to relive the exercise and tour a strategic national stockpile facility. Chairman McGovern, Chairman Morelli, maybe the Rules Committee could visit a strategic national stockpile facility so that we could learn better for ourselves firsthand. I dare say it's probably an exercise that most members of Congress have not taken. And we speak about a strategic national stockpile, but we've never actually been to the warehouse and seen for ourselves what is involved. So I just simply offer that as an observation. If the Rules Committee would like to organize a visit to a strategic national stockpile, this member would be interested in attending. So, Dr. Kadlec, let me just ask you on the Operation Warp Speed and on your team on Operation Warp Speed. You successfully were able to accelerate the advancement of some of the monoclonal antibody treatments and the antiviral agents. And your ASPR team led the allocations and distributions of these products in an unprecedented way. And now my understanding is with the change of administrations, there was at least the existence of the opportunity for procurement that your administration and ASPR had left for the incoming administration in February of 2021, that those could have been extended, but in fact weren't. And I just ask you, is that understanding correct? And do you have a sense, if it is correct, do you have a sense as to why it was not executed?
So it is correct, and we made deliberate efforts, particularly when we were setting up Warp Speed and not knowing the nature of the election, but was trying to, if you will, make sure that whatever we did would be enduring at least through the first couple of months of either the second term of Trump or the first term of Biden's administration, to give them some time to get their feet underneath them and recognize that they would need to make decisions as it would relate to the conditions on the ground that they encountered. So we had turned over, I think, in the sense of the vaccine issues, vaccine procurement, that was to the 300 million dose level, and the antiviral immunoglobulins, at least at that time, to at least give them some cushion of time and opportunity to evaluate, as well as knowing that there would be additional products coming through the pipeline. Now, two things happened and so I can't speak for the other team, but one was they had the Delta variant surge, and then clearly there were some of the monoclonals, truly the monoclonals, the single monoclonal cocktail made by Lilly that had to be reconfigured into a cocktail to ensure that it could have the coverage. So there were some challenges that were encountered that were anticipated, some that were not. But we did try to put them in the best position so that they could figure out what to do going forward. And frankly, I don't know why. Maybe there were decisions not to make further procurements at that time, but clearly they've adjusted to the realities on the ground and have expanded their monoclonals. But here's the dilemma that we have. We have, not that we have a thinking enemy, but the virus is a wily adversary and has circumvented the two mainstays of our monoclonal therapies, the Regeneron product and the Lilly product, and now we're left with GSK. So, again, this is a very dynamic, fluid environment, and you just can't rest on your laurels for sure.
Yeah, as we've learned, one of the successful aspects of Operation Warp Speed was the suspension of the normal federal procurement rules that if you had a product in development that showed significant promise, there was an ability to pre-fund the purchase prior to approval, so that the government would assume a significant amount of the risk and not the private sector. So do you have a sense that continues today? I know when we had an opportunity to just have a general HHS call with with the administration's COVID team, they talked about Operation Warp Speed and Operation Warp Speed being used to develop the Pfizer antiviral, but it didn't seem like they followed through with the advanced procurement, which seems to me to be a critical part of Operation Warp Speed. Do you have any knowledge about that?
No, not directly, but I think to your point, there was a package of things that were done that were really trying to aggressively, advance the development of a variety of different products, vaccines and therapeutics. And the kind of panoply of things that were done were, we used the Defense Production Act, which were aggressively kind of assisted companies either expand capacity or obtain priority for supplies, needed supplies, so they could manufacture or develop their potential product. We did do advanced procurement activities, particularly with the vaccines and with the therapeutics, with the idea that would just give them some assurance that if the product worked, whether it worked or not, we bought it. And as we would joke a little bit, there was no joking a lot in that experience, but we'd take a product that didn't work and just accept that was a lost investment and move to the next product and move forward. So there was an element of what I'd say risk taking on the part of the government, risk mitigation on the benefit of the company, and then really very focused product and portfolio management. And we had an extraordinary team, the public-private partnership that existed with Dr. Slawi, Dr. Carlo Di Notari Di Stefani, were exceptional group of experts that kind of help us stay on track.
Well, thank you. And again, let me just echo Chairman Morelli's in thanking you for your incredible service to our nation. Dr. Gale, I appreciate so much you mentioning PEPFAR in your discussion. That's a model that it seems like we perhaps have lost sight of recently, but enormously effective in the early part of the 2000s, at a time where it seemed like all could be lost in the fight against HIV and AIDS in Africa, and that a generation would have to be would face coming into adulthood without their parents because the disease was so devastating, and because of actions of then the Bush administration and yes, the United States Congress to participate in PEPFAR, which was really an extraordinary effort. And I don't know that we talk about it enough that I don't know that before or since, if there has been that sort of effort that one nation has made on behalf of multiple other nations. So when we think about the global investments that need to be made for future preparedness, learning some of the lessons from PEPFAR, I think, are going to be extremely important.
Yeah, I would wholeheartedly agree. You know, it has been an incredibly important program. It was comprehensive. It was global. It really built infrastructure. And in fact, the infrastructure that PEPFAR built was in large part the reason why future pandemics were able to build on that infrastructure. And so I think being able to mount something similar to that. And as you know, noted, it was started by President Bush, but it was continued on for all the next administrations, no matter what the political party was. And I think it's just one example of how global health is a bipartisan issue, and one that I think people can rally behind. And in a pandemic like this, again, none of us is safe unless all of us are safe. And I would love to see the same sort of coordinated effort that really, made sure that we were thinking about this in a very holistic way, in the way that we did with PEPFAR and the AIDS pandemic. So, I think there's a lot of lessons to be learned there, and I think it's a very important model.
So immediately prior to being distracted by the pandemic of the century, there was some discussion of utilizing the infrastructure that had been built during PEPFAR to provide a platform for improved maternal care and maternal mortality in other locations. And unfortunately, that's going to, I guess, go down in history as one of the unintended consequences or victims of the pandemic. I haven't heard recently any discussion of that, because clearly everyone's been focused on the more immediate danger of the coronavirus. And Ms. Tedesco, it's really not fair to ask you this, but I'm going to. Was Mr. Morelli helpful to you in getting the school districts to reprogram their funding that they should have been using to provide free and reduced lunches to get those funds to your nonprofit so that you could appropriately take care of the people who now weren't being fed in their school lunchrooms?
I can honestly answer, Congressman Morelli was incredibly instrumental in maybe not precisely what you just said, but exactly the spirit of that, which was coordination between the sectors. And FoodLink, even prior to this disaster, is the largest non-municipal provider of meals in our region. So we have a community kitchen. Prior to the pandemic, we were doing 3,000 meals a day. We came in, the first case in Rochester was on a Friday. We came in on a Sunday and started preparing meals and figuring out, in conjunction with the city school district, how we could get those meals to kids. And if I could connect this to the question I was asked prior, just continuing to think about that in any disaster preparedness that I've been involved with, and Dr. Kadlec, you sort of said this as well, never did a global pandemic come up. When we were talking with the Red Cross and state FEMA reps and whatever, we didn't talk about global pandemics, nor did we talk ever specifically about the crises of children being out of school. And that became the number one crisis that we addressed, not public health instantly, but kids being out of school and what we instantly knew that meant for our community and for families. And so, yes, I hope I answered your question. Yes, Congressman Morelli was incredibly helpful, but it was truly a collaborative process, and I think paves the way for what it needs to be for school districts, especially in impoverished areas like the city of Rochester, that they really need sustainable collaborative models with the nonprofit sector in order to fully meet the needs of their student body during a pandemic and during quote unquote normal times. I hope that answered your question.
It almost did. And you used the word nimble earlier, and I think that's perhaps something we should all bear in mind when we're faced with the existential crisis that this was, and the ability to be nimble in our funding. And just as the virus doesn't respect any political party, it also doesn't respect political jurisdictions. And whether it's school district, county funding, state funding, or federal funding, we need to be nimble in our response. Mr. Chairman, I'm going to reserve the balance of my time and allow you to go to other members.
Thank you, Dr. Burgess. And I do note, as it related to the schools, that one of the first requests we got from one of the school districts was to allow them to receive funding, even though they weren't providing lunches anymore. And we held a pretty robust discussion that included FoodLink because they wanted to step up and help, and certainly did. But it did raise the question of how difficult it is to coordinate in the middle of an emergency because there are existing rules, there are existing requirements you have to meet. So we went through a long process to try to work that out. But I appreciate your comments. I want to now call
Chairman,
on.
may I add one thing to that?
Yes, of course.
I want to say that I think one of the most successful things that happened during this pandemic in terms of government response was the USDA waivers that were put into place fairly rapidly. And I would truly advocate for those being extended or put in permanently, but reducing barriers to access for kids by allowing grab and go meals, by increasing reimbursement rates so we could get more nutritious and higher quality food out to folks, by doing away with what was formerly required congregate meal settings that enabled caretakers and children to eat together, to take food home to their families together, all of those things, and there's more to add to that, I believe should always be in place. They honor the dignity of the individuals receiving those services. They meet people where they are. They enable us to get better food to more people. So I applaud the USDA and the government for those waivers. Thank you.
Well, I appreciate those comments, and I'm sure Chairman McGovern, who is leading a national effort on a White House conference on hunger, is thinking about those things. I appreciate your comments. I now want to turn to my colleague and friend, Ms. Ross, for questions.
Thank you, Mr. Chair, and thank you to the folks who have testified today. I'm juggling a science, space, and technology markup, but I would argue that maybe we should get science, space, and technology to take up this issue as well, since so much of their jurisdiction has to do with things that might involve research and planning for the future. As we know, the COVID pandemic has exposed how unprepared the United States and the rest of the world are for large-scale public health emergencies. And it's critical that we learn from these experiences and use our knowledge and resources to prepare for and prevent similar disasters in the future. For years before the onset of the current pandemic, academic, scientific, and policy institutions warned of the potentially devastating impacts of a global pandemic. So did Hollywood. And as recently as 2012, the RAND Corporation concluded that pandemics were capable of destroying the American way of life. In the years following, the U.S. intelligence community cautioned in their annual worldwide threat assessment that pandemics can cause political and economic upheaval, as we can attest. Our goal today should be to address the systemic gaps that left us vulnerable to this crisis in the first place, and to ensure that science is not politicized, especially when it concerns the health of millions, not only in our nation, but around the world. We must ensure that we take basic steps to protect our own citizens first, and there are ways that we simply have not. For example, in my home state of North Carolina, the state has refused to expand Medicaid, leaving hundreds of thousands of North Carolinians without health insurance and more vulnerable to this pandemic. And I spoke with all the hospital CEOs in my district yesterday, and they continue to say that had we expanded Medicaid, things would be much better in the state of North Carolina. In addition, our public health infrastructure has been affected by staffing shortages, which some of you have mentioned, among frontline healthcare professionals. And it's critical that we in Congress provide support to our healthcare institutions to continue serving our nation as we deal with the resurgence of cases caused by Omicron and the variants that I am sure will come even on the heels of Omicron. I've also heard from educators in my district about the challenges of teaching when schools lack essential health resources. And I know we've talked about food issues, but right now what the schools are looking for are KN95 masks and COVID tests. And we know that the administration is sending them out, but clearly it would have been great if they had them all throughout the pandemic. And providing these tools should be a top priority to ensure that our children can continue to be educated and our teachers and school professionals can be protected as they serve our communities. This brings me to the importance, as Dr. Burgess raised, of continuing our effort to provide COVID resources around the world, from vaccine tests to personal protective equipment. We can't defeat the pandemic and expect to protect ourselves without coordination and support with the international community. And without investments in global health, including vaccines, therapeutics, and more, we'll continue to face new variants that develop in other countries with fewer health resources that we have. My question to all of the witnesses, and Dr. Burgess started this by bringing up the success of PEPFAR, is what strategy should we use to ensure that our federal budget accounts for the global nature of pandemics and other public health crises in a recurring fashion and not just as a reaction?
Representative Ross, I'll take a first swing at this if you don't mind.
Thank you.
And specifically focusing on, I think, the medical aspects that I think were highlighted by PEPFAR, and that is clearly it was a U.S. initiative, but in managing a pandemic, and obviously there are things called CEPI, and I applaud what the current administration is trying to do to expand, if you will, the participation of other countries to donate vaccine. There really has to be an established mechanism that builds capacity here domestically that's likely excessive to our national needs, but yet is contributable to the global needs for in the event of a pandemic. And I think that's one thing that, quite frankly, that has to be kind of considered and sized. There was discussion late in the Trump administration about creating a Marshall Plan, the idea of doing something similar to what was done in Europe following World War II, to basically enlist support of willing countries to donate vaccine globally. And I think that transitions are disruptive, but I think now that you can see that our country is kind of moving into that role, but I think there has to be a dedicated effort to build that. There's been a discussion about an international treaty to deal with pandemics, and it would seem that that would be an appropriate consideration to be part of that, amongst other things. But with that, I'll stop and turn to the other witnesses for their comments.
I can add a few thoughts, and thank you, and I appreciate the also the call out to the series of warnings that have come from the scientific community, from the policy community, from the government itself on the challenges of the pandemic. And it's something that I'm sure will be the subject of many committees, commissions, blue ribbon panels, whatever the case may be for years to come. Yeah, the data was there. The incentives were not. And so I think that there, complexity, we're entering into a more complex world. This pandemic may very well not be the last one we see in our lifetime, and with the growing impacts of climate change, it's going to get worse before it gets better. And I think that one of the key components there is we have a very distributed set of responsibilities, both throughout Congress and through the various committees. I know a few other committees have been mentioned today as potentially ones to also take this up, as well as across our government, which we've talked about. And so in a sense, almost what we need to do is to decomplexify. I'm not sure if that's a word, but to reduce the complexity of this to afford more flexibility towards a range of scenarios that we're facing that can be implemented as they're needed. I think it's also worth noting that the science provides a range of different options for managing different disaster threats, but we tend to focus on certain kinds of science over others. Up until fairly recently, a lot of mitigation efforts were focused on the built environment and engineering options, when increasingly we're seeing from the social science how social determinants can be an even greater predictor of how a community does before, during, and after a disaster. The relationships of social programs to disaster resilience after the fact is becoming increasingly clear. And we've had sort of the politics, the behavioral science. You know, why is it easier to ask people to wear masks and get vaccinated in some parts of the world than the other? The behavioral science illuminates a lot in terms of the landscape you have to work with these policies. And more individualistic societies are going to require different approaches or different levels of investment than for certain approaches than we're seeing overseas. So we do need more data, we do need more research, but there's also a lot of research that isn't really being pulled together, in part because of the distributed nature and ownership of all of this. So unifying, simplifying, I know these are overly simplistic answers, but ultimately to create capacities to harness the complexity of these situations and create vehicles that have the flexibility to meet needs that we know the outer boundaries of, but won't know the details of until they're occurring.
Yeah, and I just add, I was going to say something similar. I mean, I think, in situations like this, the knee-jerk response is to try to create something different and something new and a new infrastructure. And I think there's a lot of things that are already in place that we need to figure out how are they better connected, how are they better coordinated, and are we giving systems incentives to work together. And so, there are agencies that already have mandates, but we didn't do a good job in the beginning of this pandemic to actually make sure that agencies were working together and that there was a coordinated approach to it. And some of the structures that we had in place for disaster preparedness, which really were coordinating structures to a large degree, had been dismantled. So I think we have to think about, not looking at recreating the wheel, but really, are we doing the best job we can? And I like the notion of simplification, but really looking at how do we have the right systems for coordination. I think the other thing that has come out in many ways as we've talked about this today is that we were dealing with two different aspects of the crisis. We had a public health crisis that precipitated an economic crisis. And in both of those situations, we did not have in place the things to make us more resilient. And so we've talked about how could we make some of the social safety net issues in place and better so that populations don't get knocked so far down every time something happens. If communities that are financially insecure had greater security going into this, they wouldn't have been as harmed as they were. And so we need to think about a lot of the things that I think we did on an emergency basis showed what we could do on a longer term basis to put in place not only the health preparedness, but also the social and economic preparedness. And how can we weave that together so that whenever this next occurs, we are resilient both from a public health standpoint, but also from a social and economic standpoint.
Well, thank you all for your responses. I'm happy to take information from this hearing to the Science, Space, and Technology Committee. And Mr. Chairman, I yield back.
Thank you, Ms. Ross. I'm now going to call on Mr. McGovern, who has the distinction of being the chair of the entire Rules Committee. I appreciate him being here and for all of his help to get to the hearing today.
Well, let me thank Chairman Morelli and Dr. Burgess and Ms. Ross for their comments and questions. This has been a really interesting conversation on a very, very important topic. And as I was listening to the testimony, listening to the questions, I kept on thinking about the reality that we're not particularly good at things like planning, which is essential, or coordination. We're not very good at coordination between the House and the Senate, never mind the House, never mind the federal government, the state and local governments, and others that need to be part of it. There's an issue here of funding in order to prepare for these potential disasters. And then there's the issue of leadership, which is important. We have members of Congress when it comes to natural disasters, whether it's wildfires or tornadoes or you name it, floods, that routinely balk at responding to them after they happen, except if it happens in their own state. So there's this hypocrisy that exists. And I think part of it is that we have some people who just don't think government is part of any solution, unless it affects them directly. We heard about, all the incredible work that went into combating HIV/AIDS and the response. The Congress actually acted. By the way, after years of inaction, Congress actually began to act, and the response, included things like the Ryan White Act, and then the PEPFAR program that Dr. Burgess referenced, which was a bipartisan effort, and I think is something that we can be proud of. But this was a kind of a healthcare plus approach, and here Congress also recognized how much housing and food matter to potential healthcare outcomes. So I think I think that's an important point. On the COVID-19 issue and the response. I mean, international efforts to speed up pharmaceutical response and review process, I think was very, very important. It led to the rapid creation of a life-saving vaccine, which I think is a fantastic feat. But the bad news, of course, is that misinformation has limited our nation's ability to get shots in the arms. So the issue now is we have the vaccine, and I think I speak for all of us on this panel. I go home. I'm still trying to convince people to make sure they get the vaccine. And we have a political system here in which some go out and actively say, don't do the vaccine. Dr. Burgess waxed nostalgic about the previous administration. I look back on the early days of this crisis with a lot of shock that scientists were telling us that we had to take this pandemic seriously, and we had leaders, including the President of the United States, saying, it's no big deal, it's not real. The first couple of months, we're in denial, and Dr. Burgess, if you don't believe me, just go read the president's statements. But the bottom line is, we were being told to wear masks, and we had people actively discouraging people from wearing masks. This was before the vaccine was developed. And so you look back on that and you say, I'm hearing from now medical experts, maybe we could have saved a lot more lives if we had taken it more seriously at the beginning. I'm trying to get the White House to start focusing in on the issue of hunger and food insecurity in this country, trying to get them to a White House conference on food, nutrition, health, and hunger. One, to plan. Two, to understand that you have to connect the dots, that when we talk about, issues of hunger, it is also a healthcare issue. It is also, an issue of kids being able to learn in school. It's a whole bunch of things. We need to look at these things more holistically. But we don't have a plan in this country. We haven't had a plan to end hunger. We've had a plan to try to manage it, but not to end it. And when we talk about resiliency and all that other, all those other important concepts, I mean, quite frankly, we just haven't, we don't coordinate very well up here. Because if you're going to prepare and solve some of these problems, it's not just one committee, it's multiple committees. It's not one agency, it's multiple agencies. It's not just the federal government, it's the state and local government, it's the private sector. I mean, everybody has a role in all of this. So, you know, look, so I think what we've heard here today is some things that have gone well and that we ought to, you know, replicate, or we ought to use as a model, some things that haven't gone so well. So let me just ask this question for each of the witnesses. I mean, and whatever any thoughts that you may have, um, as it relates to pandemic or disaster preparedness in general. What is something that we've done that we should consider continuing beyond the pandemic to ensure better preparedness? And what is something that you believe we could or should have done, again, as we think toward the future, to ensure better community, state, and national preparedness? I'll just open this up to whoever wants to respond.
I'll go ahead and start. You know, I think one of the things that has been done well, as much as we lament, myself included, really quite extensively, the lack of funding for preparedness and the ebbs and flows in the annual appropriations process. We were better for having those resources over the last 20 years than not having them. The relationships that were fostered, that are frustratingly not as robust as they could be within communities, are where they are because of the capacities that have been invested into emergency management structures and into a whole of community sort of paradigm of thinking of these things. So I think that at least coming from me, while I'm critical of funding levels and lack of predictability across a lot of this, having what we have is better than not having it. Now, on the flip side, in terms of what we could do better with, you know, I think we really do have to look at the disaster science is increasingly going into the social services arena and illuminating where social services predict outcomes in disasters. And this is only going to go stronger as there's more data and there's more evidence with all of this. And I think one of the most important things to consider going forward is that investments in resilience aren't necessarily bills that say disaster in front of them. They may be investments in food security. They may be investments in healthcare to make sure more people are insured. And we have a financed national health continuum of public and private deliveries that are used to serving the whole population and not just the insured population, that's built for the kind of demand, that we're financing public health and not just taking for granted the value of that. And the other is, I do want to point out there has been a lot of talk about structures of sort of wrangling these federal processes that are distributed. One of the big criticisms of the past administration was dismantling or moving to a point of functionally dismantling the Global Health Security Team and the Pandemic Response Unit and the National Security Council. I think there's some merit to that argument, but I also want to add that it was created because there was not a legislated solution to this. So it was executive action that created a Band-Aid approach. And as the political wind shifted, that Band-Aid was removed and the pandemic hit, and we were left bare from a coordinated mechanism for doing this. And now that's being rebuilt. But I would be careful to not, it's a bipartisan issue, and it's one that ultimately we need some stability in the legislated groundwork for these things so that we're not completely reliant on executive action, which can be undone as easily as it can be implemented. So I hope some of that is marginally used to you and appreciate the opportunity.
Anybody else want to?
Yeah, I would say, I think a couple of things that we did well. And this was mentioned earlier, I think the coordination with the private sector was critically important, and the ability to develop vaccines in record time, which built on a lot of important science that was being worked on already. So, I think that our investments in new science and discovery, and then the working with the private sector, I think was really critical and a model that we need to think about how do we do that in the future. I do also think that the speed with which emergency support and the level of emergency support that was mobilized was incredible, and the willingness to do some things that we'd not ever done before, like give people cash who needed cash to pay their bills, and some of the things that I think could be models for how we think about building resiliency in the future. Things that I think we didn't do as well, the coordination, which we've talked about multiple times, and the communication. I think the fact that we had mixed messages, the fact that we sowed, seeds of doubt and confusion is not what you need at a time like this. At a time like this, you need clear communication, you need strong leadership, and you need consistency. And so I think that was one of the things that, was a real challenge. And I would say the other is that we were pulling out of global collaboration at a time when we most needed global collaboration. The idea that we were going to pull out of the World Health Organization at a time when we needed to come together as the world community more than ever. So anyway, those are some of the things that I think we did right and some of the things that I think we could do differently next time.
Thank you. Gabrielle?
I would just add, a lot has been said about strengthening the social safety net. So I would, just in my final remarks here say that it's something we did well during the pandemic. And it's something that if we are willing to do during that type of crisis, I think we need to consider why we are not willing to do it all the time. We had an unprecedented level of investment in food and recognition of the issue of hunger, partially because hunger is tangible, but it really in our nation is another word for poverty. It's not a matter of food, it's a matter of a trade-off because of limited economic resources for families. So we need to continue to invest in anti-hunger and put the infrastructure behind it. And as I argued, invest in nonprofits as partners. But in the broader sense, we now know, and it was said multiple times on this call, that pandemics, disasters disproportionately affect those who are economically disadvantaged, Black and Latinx communities. And so for the long term, investing in the social safety net is to me the best preparation for any future disaster.
No, and I appreciate that. I always tell people that, we had a hunger problem and a crisis before the pandemic. We just weren't coordinating an effort to respond to it appropriately. We had close to 38 million people in this country who didn't know where the next meal was going to come from. And the pandemic just highlighted the disparities that already existed. And so, I mean, it's more than just we're responding to an immediate crisis. We got to solve the problem. I don't know whether, Mr. Kadlec, do you have anything you want to add?
Yes, sir. I do, Mr. Chairman, and that is, it was mentioned already about the public-private partnerships, and particularly around medical countermeasures. That model, quite frankly, can be used in a much broader context, whether it be about surveillance of diseases, whether it be about testing, whether it be about supply chain, whether it be about healthcare provision. It would seem that that's a model, and quite frankly, to your point about how do you manage, hunger in America, it really does require a whole nation approach. And quite frankly, that model to work against these very troubling problems, whether it be during a pandemic or not, I think is a model that can effectively be mobilized in a way that, quite frankly, is demonstrated by things like warp speed. The second area is, and this gets to more public health, or not public health, but healthcare provision. And that is, even right now during Omicron, with the availability of vaccines and other things, we're finding not only are we having problems managing cases of COVID, but non-COVID emergencies, non-COVID chronic cases, both in rural and urban environments, and affects all access groups, and particularly those who have difficulty getting access to healthcare. And I think that's one area that has to take maybe some kind of priority view. Public health has been defined as one of the critical gaps in our pandemic preparedness. And I would argue that our ability to provide healthcare across the range of conditions that we need to, in a pandemic or not, was severely challenged during this crisis and could be similarly challenged through other crises that are not necessarily infectious disease related. And I think that that's one thing that has to be evaluated.
No, I think that's an excellent point. Again, I want to thank Chairman Morelli for putting this hearing together, but I think you challenge us to think bigger and more holistically, which is something that is always very difficult to do. And I mentioned I talked about hunger in the beginning, but I also sit on the Agriculture Committee. So when we talk about combating hunger on the Agriculture Committee, we talk about SNAP. Well, that's not the whole answer, right? If you want to talk about school feeding, you got to go to the Education Labor Committee. If you want to talk about food as medicine, you have to go to Ways and Means or Energy and Commerce. And, the same within our agencies. And I think there needs to be a better coordinated effort to look at things more holistically. I think it would enable us to be better prepared for upcoming disasters, whether they're climate related or whether they're pandemic related or, who knows what related. But anyway, I really appreciate the expertise of this panel. And again, I thank you for your comments.
Thank you, Mr. Chairman, for not only for being here, but the incredible work you're doing on addressing hunger in America. Just a couple of quick follow-ups because I'm mindful of the time and appreciate all of your the time and expertise you shared with us this morning. I want to give Dr. Burgess a chance to ask any additional questions he has as well. But Dr. or Mr. Schlegelmilch, you mentioned the value of investments in mitigation in comparison to funding for disaster response. And I wonder if you could, first of all, before you even talk about your research showing the benefits of proactively investing in disaster mitigation measures, could you describe for me what those disaster mitigation measures are, what in sort of a tangible way? I'd be interested to hear that.
Yeah, yeah, and so it's I appreciate that. The research has been conducted by some other groups. So FEMA has commissioned from the National Institute of Building Sciences a look at some of the more specific mitigation measures. So that's where you get this term, $1 in preparedness saves 6. It comes from sort of specific kind of physical mitigation measures, but then you see benefits downstream. There was a group of political scientists that did some research that found that number anywhere from one saves $12 to one saves 15. They were looking at more catalog of federal direct assistance numbers and sort of categorizations and things like that. So we definitely see this trend. There have been other analyses for pandemics by the World Bank and others. The number varies, but the message is always the same. So what we've seen primarily in these investment decisions have been more on the physical and administrative side, putting in planning processes and things like that. The social science research is getting more and more into sort of the value of these things. And I think we're going to start seeing more of that in the valuations going forward as well, too.
Gotcha. And you also, I think you talked about this, but in November of 2020, FEMA released a report finding recovery programs often provide an additional boost to wealthy homeowners and others with less need, while lower income individuals and others sink further into poverty after disasters. And a number of people have talked about this, but from your perspective, what accountability and transparency mechanisms are available to ensure any increases in disaster preparedness and assistance funding is spread equitably among low-income and minority communities? And do you have any specific recommendations for how Congress could improve those mechanisms? Any suggestions or thoughts?
Yeah, absolutely. And there's also been some independent research looking at the various federal assistance programs as well, too, and similar disparities among socioeconomic status and racial categories. And so in terms of that, I think first and foremost is data transparency and reporting, to have demographic breakdowns, to know where the money's going, who's getting what these are. It sounds like a simple thing, but often it is not immediately available. The other would be, we saw with some of the COVID funds a nod to using the Social Vulnerability Index from the CDC, and there are plenty of tools out there to help kind of identify and steer resources towards areas that are in higher need and higher states of vulnerability and higher states of social vulnerability. We see this built in with FEMA's National Risk Index, and so we're increasingly seeing this but there isn't much accountability. So there's a lot of lamenting of various officials on the inequity, but not necessarily a mechanism for accountability. And then the final piece, actually a colleague had brought the idea to me, is to have a scoring mechanism, much like the Congressional Budget Office will score financially different bills, is to have an equity score and to bring together a panel of experts who can actually look at the equity implications as well as broader resilience implications of various bills, various traps, and actually provide more specific guidance on a case-by-case basis.
Thank you, that's very helpful. Dr. Gale, do you have any thoughts on that, how that impacts either your agency or Chicago writ large, and any thoughts about that, or nationally, but I'm just curious about your experience.
Yeah, well, I would just in some ways echo some of the previous comments, because what we saw in the beginning of this pandemic is that we didn't have data to even know who was being impacted by demographic groups, and particularly race, ethnicity. Chicago was one of the first cities to actually look at COVID cases by race and ethnicity, and it was a critically important piece to then putting in place systems to address the disparities accordingly. And I too have talked to and been in discussions with people about coming up with some of those scores. If equity really is, if we're going to be accountable for thinking about equity, are there ways that we can build those into, just like we do environmental scores that are built into new development projects? Could we do the same sort of thing of building something that kind of built on the social vulnerabilities index or other things to allow us to be able to have that accountability in there? But I think first and foremost is we've got to collect the data.
Yeah, and I actually, Mr. Tedesco, from your perspective, have you been tracking that data on who you serve? Could you report back or have demographic information on who you served over the last 2 years?
It would be difficult. We have number of households served, and we have some demographic information, and then obviously we have other data that we're pulling from census data. But because of how food banks operate, we rely on a network of providers. Many of those, these are small grassroots community-based organizations who are required to track the number of households they're serving, required in some cases to get attestations of need from those families, but not always required to do demographic information. So we know partially just by looking at our geographic region and understanding the demographics there, and looking at need and service levels in those areas, but don't have hard data associated with it.
Gotcha. No, that's certainly understandable. Last, I think this is.
Could I add just one thing to that? Earlier we talked about building community-based organizations' capacity. And I do think that by building capacity at the local and community level, that is helping to build an accountability mechanism as well. And I think that the more we have strength from our civil society sector, it does build in an accountability, because I think when people are able and capable of looking at how dollars flow, able and capable of applying for those dollars, and also, being able to ask for what is rightfully their communities because of where the needs are. I think we do build in accountability. I mean, that's what democracy, after all, is all about.
No, I very much appreciate that. I did want to get into the issue of long-term funding, stable funding that didn't rely on emergency appropriations. I wonder, Dr. Kadlec, if you could just comment on the advisability of that. There's been a lot of conversation about it, but from the point of view, again, of having worked in an administration, how important is that, and how should Congress be thinking about that in terms of long-term funding the appropriations process rather than supplemental or emergency appropriations?
Well, first of all, I just want to acknowledge that the funding that you provided, Congress provided during the course of the pandemic, during my tenure, was very generous. However, However, there's this issue of an ounce of preparedness is worth a pound of response dollars. And that the fact of being able to be a good steward of the taxpayer dollars in a response, and I'll just give you one example, and it had to do with ventilators, for example, and the fact that we bought 243,000 ventilators that, quite frankly, we didn't need. In fact, we bought types of ventilators that, quite frankly, were problematic because, as we learned very early in the pandemic, I mean, this is how you have to learn and get back to the data issue and how vital it is to have quality data. We didn't have quality data early, and yet, based on a little bit of serendipity and focus, we were able to recognize that certain techniques to manage people with the severe cases of COVID, that in some parts of the country were resulting in people being on mechanical ventilation, and was the thing that scared everybody to buy 243,000 ventilators at $3.5 billion, was recognized that was actually resulting in higher mortality, upwards over 80, close to 90% mortality. Whereas in other parts of the country, and this is a great story, and a lot of credit goes to the state health officer in Louisiana and a pulmonologist that he worked with to create a state system where they use proning and high flow nasal cannula, which is a non-interventional way of managing somebody's ventilation. So you don't need all the specialized drugs and paralytics and paralyzed people and a lot of intensive care nursing staffing. And so by just that virtue thing alone, based on recognizing that, we were able to do a couple of critical things to first of all, not need the ventilators. And that was just an example of where you had to make big purchases because it took a long lead time to get those devices in there. And so I only use that as an example of saying, if we kind of fund the needs and based on requirements, based on exercises and working with state and localities on what the needs would be in the event of a crisis, we can be a better steward of the taxpayer money. So you pay $1 today or $100 tomorrow during a response, is, I think, the trade-off. And it really is something that you can't just invest in, buying stuff. You have to, invest in training people and exercising capabilities, which is the combination of people and stuff, to make sure all this stuff works. To Chairman McGovern's comments about coordination and planning. Those are all critical elements of the preparedness quotient that are, low dollar value, but high response impact. And so I'll just stop there and just say, it's really how you want to spend a little now, or you want to spend a lot later, and knowing that when you spend a lot later, you're going to be less efficient and likely wasteful in your efforts.
I think there was an old TV commercial, you can pay me now or pay me later. So I appreciate that. Dr. Burgess, let me turn to you for any additional questions you might have.
Thank you, Chairman Morelli. I'm going to submit some additional questions for the record, but I have two unanimous consent requests. One from Research America, a letter that they've submitted to ask that be made part of the record. And then earlier in my testimony, I referenced a letter that I wrote to Chairman Helene, and I would ask that be made part of today's record for this hearing, and I'll yield back.
Without objection. Let me just thank everyone. I do note that a lot of the conversation has been about planning and coordination, resiliency, communication, trusted communication, and funding. And I'm thoughtful back many years ago when I was in the state legislature, I was chairman of the insurance committee. And I remember, people don't want to pay insurance premiums. Let's face it. It's the last thing any of us really wants to do. But in a moment of crisis, having prepared and thought about it in advance really takes that moment of crisis and makes it hopefully more manageable. And I think in some ways that's what we need to do is provide those insurance premiums so that in a moment of crisis such as we're facing now, we're really in a much better position. And finally, I even think I serve on the House Armed Services Committee. You know, the amount of planning that the military does for potential threats is virtually unlimited. I mean, we're constantly training. Colonel, I know you would attest to that, and yet we do so little of it when it comes to domestic challenges like natural disasters or the pandemic, which we're going through. And so we might want to take a page out of the military's book as it relates at least to training people, capabilities, threats, and really make that part of our national dialogue. So with that, I want to thank all the witnesses. You've been incredibly helpful to us as we go through our deliberations about how to move forward. And I want to thank you all for the incredible work that you've done to keep safe and help protect people in your communities and across the country. And with that, I will officially declare this hearing ended. Thanks so much.